Hello, I'm Dr. Amanda Damiano. I'm an assistant professor of communication at Marist College in Poughkeepsie, New York, in the United States. I'm proud to be sharing my project with you today entitled A Content Analysis of Tweets in the United States About the COVID-19 Vaccine. I began this study in January 2021. At that point in time, history was made in the United States when vaccines were administered to people across the country. The picture here of Sandra Lindsay is iconic as she was the first American and ICU nurse to receive a COVID-19 vaccine. Currently, 3 companies are offering COVID-19 vaccines in the United States: Pfizer, Moderna, and Johnson & Johnson. At the start of 2021, pictures of UPS and FedEx trucks appearing at warehouses to transport vaccine doses across the country brought much relief to people in the US and across the world who have been contending with this awful virus. On social media, the COVID-19 vaccine has been a dominant topic of conversation. Using a social media listening tool, Salesforce Social Studio software, we conducted a search of tweets and found that more than 500,000 posts contained the keyword COVID-19 vaccine just in the month of January 2021. What we have here is a list of top words appearing in those social media posts. The largest words are, of course, our search terms, COVID-19 vaccine, but then you also see reoccurring words that were frequently found in posts, some from the brands themselves, like Pfizer, or their CEO, Burla, Johnson as well, and overall concerns, everything from people being older, to survival, to eligibility. The current state of affairs in the United States regarding the virus and the vaccine brings much to research. As of the end of March 31st, 2021, almost 550,000 Americans had died from COVID-19. People are still getting infected on a daily basis and dying because of the virus. Also, there are more contagious variants from other countries that are rapidly spreading across the country. In terms of the supply of the COVID-19 vaccine, although manufacturing is ramping up, supply is still limited, and to get additional doses is not an easy process. Getting an appointment to receive the COVID-19 vaccine is also quite difficult. There are a limited number of appointments, and each state has a different approach. Locations vary from grocery stores to drugstores to state-run testing sites and vaccine sites. Eligibility has also shifted over the last several weeks. Early on with first responders, healthcare workers being eligible, then shifting to people working in professions where they're public facing, including teaching. Now, of course, where anyone above the age of 16 is eligible for the vaccine. Inequity is also an important concern. Whereas far fewer minorities are receiving the vaccine in the United States than Americans who are white. Access is an additional problem where there are a number of healthcare deserts in the United States, which makes it difficult for people to go and find a location where they can receive the COVID-19 vaccine. Furthermore, to make an appointment, one must have an internet connection. As a result, if you live in an area where you don't have the signals to get access to the internet, or if you don't have the socioeconomic status to afford the internet, it makes it very trying for you to get an appointment. There is a great deal of distrust particularly from minority groups who are skeptical of the medical community, which goes back to many years related to unethical practices. Overall, there is much hesitancy with taking the COVID-19 vaccine. Many people feel the vaccine was created in too short of a period of time. There's distrust of the medical community, as well as distrust of the federal government. And there's overall concerns about the vaccine effectiveness, the short-term side effects, and the possible long-term effects. This study is grounded in risk communication research. Risk communication is the process of informing people about potential hazards to their person, property, or community. It is essential that we convey information to people, particularly when it is dangerous, of a risky nature. Sandman conducted 2 seminal works where he examined the essential aspects of risk communication. He said that risk communication involves how to scare people. When the public is not taking the risk serious enough, risk communication needs to be used to get people informed to the point where they're willing to take action. A second aspect is how to calm people down. Sandman found that sometimes people are so concerned about the risk that their concern far outweighs the actual risk from the potential threat. As a result, risk communication needs to be used to allay people's fears. Sandman found that 2 additional factors are present in the risk communication scenario, particularly hazard, which looks at expected negative outcomes, and outrage, which looks at reaction of the threat. In a nutshell, risk communication is essential in terms of hazard and outrage. If someone sees expected negative outcomes to be significant, and if someone is significantly upset about the threat, they are more willing to act accordingly. Vaccine conversations on social media are nothing new. Long before we had the COVID-19 vaccine, and long before we had COVID-19, conversations were taking place on social media about vaccines. For many years, there have been skeptics, critics, and those considered to be anti-vaxxers. For several years now, people have said that vaccines can be linked to autism. And during the Zika crisis, a number of conspiracy theories propagated. However, there are some silver linings. In particular, researchers found that when health information is shared on social media, people are paying attention and people are influenced by what they're seeing. In this study, the purpose was to review tweets about the COVID-19 vaccine in the month of January 2021 and February 2021 to better understand perceptions. 6 research questions were proposed. Specifically, how was sentiment about the vaccine presented? What risk perception was appearing in the tweets about the COVID-19 vaccine? What risk perception about COVID-19, the virus, was present? How blame about the COVID-19 vaccine was discussed? How outrage about the COVID-19 vaccine was discussed? And how political frames were used when discussing the COVID-19 vaccine. In particular, this study looked at variants over the time period January and February 2021. A content analysis was conducted of public tweets. Myself and one of my colleagues coded all of the tweets. We looked at 50 tweets initially to determine intercoder reliability. Upon having a high degree of reliability for all of our measures, we proceeded to code tweets from January and February. Our combined sample, a simple random sample, consisted of 1,050 tweets. Our measures included sentiment, COVID-19 vaccine risk, COVID-19 risk, blame, outrage, and political framework. What we have here is more information about Salesforce Social Studio, the social media listening software. When conducting the search of COVID-19 tweets, we received a number of pre-packaged data points. One test in particular was the influencers list, which provides a detailed account of major influencers on social media talking about COVID-19 and the vaccine. This is a clout score where 100 is perfect. So you see high scores in the 90s from major news outlets in the United States. A media type trend was also included, where we see the peaks and valleys associated with Twitter content about the COVID-19 vaccine. Keeping in mind, this study only looked at January and February, though you can see a number of conversations taking place during that framework. The actual feed breakdown included all individual tweets about the COVID-19 vaccine. A sentiment analysis is also conducted through Salesforce, where tweets and their content are coded on a 3-tier system of positive, negative, and neutral. It's important to note that we as coders, human coding for sentiment was actually undertaken for this project. Keeping in mind, when it comes to artificial intelligence, the computer may not be strong enough to determine things like sarcasm. What we have listed at the bottom is an Excel spreadsheet. This is how the data was exported, where we have all of the feeds listed in just written format here. And this spreadsheet allowed us to set up our code book and of course do our coding. Of our 6 research questions, we conducted a number of chi-square tests and found a great deal of variance over the 2-month time period. In terms of sentiment about the COVID-19 vaccine, we found that tweets in January mainly had negative sentiment, whereas positive sentiment was dominant in February tweets. Our second research question about risk perception regarding the COVID-19 vaccine was interesting in that half of the tweets in our sample did not contain any vaccine risk whatsoever, whereas the other half did, and the vaccine risks were quite different. A number of vaccine risks were noted in the tweets. In particular, safety of the COVID-19 vaccine was a dominant risk. We found that tweets in January expressed much more concern about the vaccine safety, whereas tweets in February were not nearly as concerned about the vaccine safety. Sticking with our second research question in risk perception, we found that equity risks were also dominant in social media conversations. More tweets in January expressed concerns about vaccine equity than those in February. Whereas we found in February that tweets expressed more vaccine hesitancy than those in January. Tweets in February also expressed more concerns about vaccine eligibility than those in January. Finally, in terms of vaccine supply, we found that there were more concerns in February than those in January, according to the Twitter posts. Our third research question about risk perception regarding COVID-19, the virus, revealed that there was no difference between January and February. Risk perception remained the same in January and February. Blame about the COVID-19 vaccine also varied between the two time periods. We found that tweets in January tended to blame the government more so than those in February. We also found that January tweets tended to blame individuals more than those in February. Regarding outrage about the COVID-19 vaccine, we found that hazard and outrage varied over the 2-month period. More tweets in January expressed low hazard and high outrage than those in February. However, tweets in February showed low hazard and low outrage as opposed to those in January. Our sixth and final research question found that political frames were in fact used heavily in the month of January, not as much in the month of February. In particular, January showed a number of liberal frames and tweets, as well as a number of conservative frames and tweets. Reflecting on these results, it was interesting that positive sentiment was so dominant in February. It makes sense, however, as we saw an increase in the number of people vaccinated, an increase in the supply of the vaccine, and an increased number of vaccines available, where we saw the Johnson & Johnson vaccine become available. The stock market also climbed, which was another added bonus, making people feel better since we had an economic boost. The fact that the vaccine risk shifted over time was interesting. Early concerns about the vaccine safety and equity were soon replaced by issues regarding vaccine hesitancy, eligibility, and supply. The fact that there was no change in COVID-19 risk over the 2-month period makes sense, keeping in mind this pandemic has lasted for 14 plus months. As a result, 2 months really is a very short period of time to look for any type of change. Regarding blame, it was evident that early anxiety resulted in people expressing blame about the government as well as individuals. It was well documented that the government rollout was particularly slow in the United States. The fact that outrage decreased over time is important. Keeping in mind, usually with high outrage and high hazard, there's increased risk perception and the likelihood to act. In this case, with lower outrage and lower hazard about the vaccine, we can only hope that this will encourage more people to go out and get the vaccine. Finally, the early political ideological tweets represent what was going on in the time in our country in early January before the new administration took office in mid to late January. As a result, political conversations were very dominant when we saw the 2 political office shifts occur. In conclusion, this study provides great insight into public opinions about the COVID-19 vaccine. It's important as public health officials look for strategies that they can employ to best reach audiences and encourage vaccinations. There are limitations to this study in that this is just a small snapshot of time, knowing that vaccines will continue to be administered for many more months. The sample size of tweets is also quite small, knowing that thousands of tweets were sent in January and February, and thousands of tweets have been sent since then. Moving forward, there's a number of ways to continue this research: increasing the sample size, increasing the time period when the study examined COVID-19 perceptions about the vaccine. There's also opportunities to look at additional factors. Now with people getting vaccines, there's conversations about vaccine passports and discussions about privacy concerns and risk perceptions. Many research areas to pursue further. In the meantime, I've included my references, and I thank you for your time. I hope you enjoyed this presentation, and I look forward to hearing from you and being in touch. Thanks so much.